It's recording. But then Katie, your face is in the middle, so I don't know how to get it to where ours is the bigger one.
Like my picture of me in the hat.
Yeah.
Oh gosh. I don't know. That's a mystery.
You know, when we do our class on Friday and like the is in the middle.
Yeah, go. Do you have like those 3 dots anywhere on your screen that like will open up like a panel of options?
I have like the participants.
Click your video. Click video. Like the folder that has like the different kinds of criteria you can edit.
Oh yeah.
Do you see where it says like put you in the front or whatever?
It says mute, stop, pin, hide self, rename.
Boy, okay, that's not usually what my computer shows.
Oh, there we go. Pin video. Okay, cool. So now we're on the front. And then I'll just wait. All right, we're up and running.
Peter's got his pizza.
Peter's got his pizza. We are in full swing. All right, so this is Peter and Rachel. They work here at the FIRC, and I will let them tell you a little bit about their roles, and then we can kind of go into some of the questions. So we got Stacy and Kaitey on the Zoom, and then we got one other group member that's not here. But so Rachel, if you want to tell them what you do.
Yeah. So my name is Rachel. Would you prefer that I look at the camera or I look at you?
Either way.
Okay. My name is Rachel, and I am the mental health navigator here at the Family Intercultural Resource Center, and that is a position funded by Building Hope, a local community mental health initiative where Casey interns. And I have been in social work for several years and recently got my master's in social work and have been honored to come back home and work here in a field that I think is super important, and have been employed at the FIRC for a year and a half. Peter hired me.
Did I?
About a year and a half ago. Sure did.
Strong hire.
Yep.
Very strong.
Yeah, and I originally worked in a program called Colorado Community Response, and now I work as a mental health navigator. So my role with navigation is really to help connect people to services for mental health and reduce barriers, increase access. And we do that a little bit through solution-focused meetings together, as well as kind of referrals out to the community, case management, really a whole slew of things that can come up with mental health barriers. And I do that with English speakers, Spanish speakers, kind of the array of community members. I just got my first client from Senegal, so that's exciting.
That is exciting.
Yes. And I love it. I love working here. It feels very full circle. I was born and raised here, and it's a great way to give back. Do the dream social work job.
Yes, you're killing it.
My name is Peter, and I am currently Director of Operations at the FIRC. I was a volunteer with the FIRC on the board of directors for about 7 or 8 years. When I was working in the restaurant business, managing a restaurant here in Breckenridge, which I did for 18 years. And then I had the opportunity to join the staff of the FIRC, and I was working with the programs for the first 3 years, and now operations and some programs, a housing program. We've done some immigrant events, immigration-based events in the community. This is an immigration-based kind of discussion we're going to have, right?
Yep.
Right. So, and so yeah, that's me. And I, forgive me, I was at our mobile food pantry all morning, so I did not get a chance to read the questions that I see that you sent over mid-morning. So I'll wing it.
Perfect. That sounds great. So I guess we'll just kind of go around. I printed out some of the questions. We won't keep you guys for too long, but maybe if you want to give us just a brief overview of the FIRC's role with the community, with the immigrant documented and undocumented population here in Summit County, or how you see your roles fit in with that, or any sort of kind of interfacing you've done, or program areas with the immigrant community.
Well, as we all know, immigration, this topic is very sensitive. And the FIRC is the Family and Intercultural Resource Center. It began 25 years ago as a family resource center with a fairly narrow mission. And it was set up originally by legislation from the state. And then around the year 2000-ish, a group of folks got together and decided that with the influx of immigrants, they were going to need a place to go for resources. And that's when the intercultural piece got added. But the FIRC is not an immigrant rights organization. The FIRC is a family center with a mission to support family stability. And the FIRC has a broad support base throughout the community. That said, we work with a lot of the immigrant population and their families in Summit County. I think, and correct me if you've heard wrong, but I think about 50% of the clients of the FIRC have Spanish speaking in the home type thing. About 50% don't. In our community, there's around 30% in the schools who, kids who have Spanish spoken in the home. So the percentage of immigrants in the community is fairly high. Yeah, and that's the general piece of it.
Mm-hmm.
So, we work with the immigrant community. We do work with folks who are undocumented.
Yeah, I wouldn't have a lot to add to that. I think as somebody that grew up in this county, I had a sense that there were a lot of Spanish speakers here, but I didn't really know. My circle was really small at the time. And my real interaction with the immigrant community or with folks that were not white in Summit County was mostly on the soccer field. So now that I'm back for the second time and having had a social work education and having been in some more diverse areas, I really do recognize the diversity of Summit County, which is what drew me to working at the FIRC. I think we are kind of the central hub of where folks feel safe to come get information and to get services, and it's a really neat way to serve that community. And we also do have really diverse staff, not that you would know it from looking at Peter and I necessarily, but I think at least 50% of our staff are Latino, and I think even more than that, probably 60 or 70% of our staff does speak Spanish. So
I think at least, yeah.
So it's a pretty cool work environment as well with folks way different backgrounds.
Can you tell me a little bit about what you're putting together? What is it you're working on with these questions?
Yeah, so we have to do a group project highlighting a local resource within our communities, even though we're all kind of in different areas. So it makes it kind of hard. But they wanted to highlight the FIRC for just their role with any sort of immigration groups, any sort of program areas with immigrants, documented and undocumented. We've done a lot. This is for our class on Friday night with a teacher named Lorena. And so she kind of has an overview of different questions. We're just kind of supposed to highlight what the FIRC's role is with immigrants in our community.
Have you talked to Michelle yet?
I'm going to hopefully next Monday or Thursday hook up with him. Yeah.
Well, I can let you know a few of the specific programs that kind of have started since the presidential election in 2016, those elections. We did facilitate a series of community events where we had a community panel and addressing, issues that came up in the community, whether from the Latino and immigrant community or from the Anglo community. And the FIRC, since the FIRC was involved in those, we tried our best to keep those apolitical and really offer supports and information, bust some myths to all segments of the community. Since then, we've taken on a program, thanks to some private donors, to support young people who are renewing their DACA applications. Originally, we were, so we have scholarships for that. So originally we had scholarships for people applying for DACA and renewing, and currently, you can't apply new for DACA, but you can continue to renew, so we continue to do that. And so, and the one reason that, that's okay with the FIRC and the FIRC board and the FIRC administration is because the DACA is a program with some legal standing.
Mm-hmm.
And so as a 501c3, we have to walk a line, and then we have, the direction that the board wants to take us in terms of our overall mission and our overall community involvement.
Yeah.
But those are some specifics of how we've addressed, this issue. And Michelle can talk more to that because he runs the DACA scholarship program.
Okay. Wonderful.
Michelle is also doing a program where he is coordinating people who are looking to try to get a driver's license who are undocumented, and it's through the SB 251 law. I think that's the right phrase, number. And he connects them with others in the community who help them facilitate getting an appointment and going through the paperwork for the driver's license.
Cool. Very cool. So some specific areas.
I know you have specific questions. I
Yeah.
can probably pick up the other
Yeah.
programs and things that we do.
Yeah, absolutely.
Yeah.
And yeah, so I'll see if either of them have a question they want to throw in with that, or I'll just keep going. Stacy or Kaitey?
Yeah, I would just say, you mentioned that you kind of have that line to walk and have to kind of keep it apolitical. And I'm curious, what strategies you have to do that, because I think that's probably a real challenge, especially in this, climate that we're in. Like, what strategies or maybe challenges have you faced with that?
Yeah, so I think in general, the FIRC is not shy about saying that we're a safe place for documented, undocumented immigrants, a place where they can come to get information about what their rights are, a place where their status and their current legal rights are protected. And so a lot of folks have been worried about if their information will be shared or not in the, shared with the government. That's something that across the board we're just really careful about and making sure not to put that in any of our records about their documentation status, so that there's no concern that that will be shared. And, I think we've kind of made ourselves a place in the community where people can come and get information. For example, with the public charge kind of program and information about that in the community that people are now worried about getting WIC or food stamps or something like that, because it will endanger their future status or ability to apply for legal permanent residence. We've just made ourselves a place that we try to be really well educated about that, so that we can share that with our clients and put on kind of events in the community where they can come and learn about that as well. While also, there are especially things around employment. We have to verify employment, like social security numbers and that kind of thing. So that's where we really have to walk within the lines of government protocol. But I think, around the community and the surrounding communities as well, we've just sort of made a name for ourselves about being protective and sensitive of that information in a place where people feel safe.
The question is a real good one because it's a very difficult subject, a difficult line to walk, and every organization is different. And every organization has a different focus, and the FIRC, for instance, uses the E-Verify system upon hiring employees because we have some federal money. So we're required to, by, in certain ways. That's just an example. But it's tough. It's, we just try to be, when it's the FIRC in the community working on this issue, it's apolitical. And it's just supporting families. That's what the FIRC's mission is, to support family stability. And, that's what FIRC focuses on.
Yeah, thank you.
Yeah, and sometimes it's really important for us to share that, like 50% of the people that use our services are not, a lot of the people that use our services are not immigrants, or just because they're Latino doesn't mean they're an immigrant or that they have a certain status. And so, for example, our health navigation team serves like a wide array of incomes and ethnicities and races and languages, and our mental health navigation program serves just a whole variety of folks as well. Sometimes it's easy to get stuck in the stigma that the FIRC serves only Spanish-speaking clients or this or that. So we spend a lot of time trying to debunk that myth as well.
Yeah, for sure. And then you guys both kind of like touched on it, but you talked about like the FIRC being a safe place for people with not being documented or whatnot. Is there any sort of procedures or policies? I know you talked a little bit about it, but to make sure that folks are feeling safe when they walk in the doors, and like what kind of, would you be able to go a little more in depth with that maybe?
Yeah, I think just as far as paperwork, none of our paperwork requires a social security number or any verification of status. We make it really clear that you're welcome to get our services whether or not you're documented, and then that just mostly spreads by word of mouth after that. There are a couple programs like health insurance. You have to have, unfortunately, a social security number in order to register for health insurance. So there are some limits just as far as what's available policy-wise, but we really try to work around that and try to make things available for folks like medical assistance if health insurance isn't available.
Yeah. I think some of the program areas, even yours, like with the mental health navigation, you don't necessarily, like a lot of people come in without health insurance and you're able to give scholarships if they aren't. So
right.
You're kind of able to get around the.
Yeah, that's a great example.
Yeah. Cool.
That is how we make it welcoming.
Yeah.
By not asking, some of those questions and not, making that determination of whether you get services or not.
Right. Yeah. And you think in the community, with documented or undocumented, it's a lot of spread through word of mouth and just, someone feeling safe here and telling their friend, and
yeah,
cool.
Yeah, and 20 years of working in the community in that way. So
yeah.
Katie raised her hand.
Oh my gosh, you can raise your hand on this. All right.
Yeah, I was being dorky about that. So I'm just curious about capacity for you guys. Do you feel that, you have the adequate amount of staff for the needs of the community coming in?
I mean, it kind of depends on the program. We do have a really robust staff. I mean, I think there's like 50 people that work for the FIRC. Some of those are in our thrift stores, which helps bring in revenue, and that's what Peter's over. And we have a large kind of immigrant or Latino population that works there. But it depends on the program. I think for mental health navigation, we definitely don't have the capacity for all the referrals that are coming in, despite mine and Casey's best efforts. And part of that, too, is that what we're referring out to is other mental health providers in the community. At the moment, we only have 3 Spanish-speaking providers in the community, none of whom take insurance. And so we're able to kind of help with that with our scholarship that we provide to folks. And a lot of our Spanish-speaking population gets a scholarship because they're really working hard to make ends meet here. And so that's one way of helping, but we're always in search of more Spanish-speaking providers, more mental health resources as far as referring out. But within our team, I think, and the staff that we do have, we stay very, very busy, but we serve a lot of clients, something like 4,000 in a year. I just saw that the other day. So Anita would have more of that information than I do. But we have a lot of staff. Yeah, good question.
Cool.
Thanks. I appreciate it.
Yeah.
Mhm.
I was going to ask like how you make the, how is there like a coding system or something for how you make the determination? Like I know you said you have scholarship funding. You know, if you have like, you know, whatever, 10 people that need scholarship for like mental health, how is that decision made? Is it kind of just staffed as a unit and then whoever has sort of the highest need, or how do you guys do that?
So we have a couple different financial assistance opportunities. Unfortunately, we have a really generous donor base that we have quite a bit of funding. So at this point, it's not, we haven't ever come down to the wire of either this person gets it or this person gets it. Over the last year and a half, we've given out something like 275 scholarships for mental health. And that none of them take away from the other one. And so it's also nice because we don't need to do a bunch of income verification or anything like that. We really just have folks vouch that it would be a financial burden and barrier for them to access therapy by paying out of pocket. And we try to connect them with a different payer source like insurance if it's possible. But especially for folks that are undocumented, there's not a lot and they're not able to bring in a lot of income with their status. And so, you know, there's not a lot of hoops to jump through. It's a quick meeting and we have several folks that can offer the scholarship, which makes it really accessible and I think not shaming. And also it takes into consideration that there's a lot of factors that could keep you from being able to afford it. And we sort of do the same thing for our family support department, which helps people with rent. We don't say this person or this person. We have some policies around how many times you can get help and what we can help with. And then we staff that every single Wednesday to talk about the case and see if there's other resources and approve the financial assistance. But yeah, we're really lucky to not have to kind of choose between who we're going to help.
That's a good question. You know, if you're thinking about you're going into social work, going to work for an organization, we have lots of different opportunities for different kinds of assistances and scholarships in different programs. Mm-hmm. And, you know, building that screening tool, the criteria, what are the criteria? What are we going to screen? How are we going to decide who gets it? It's different for every program, but it's a big part of it. Mm-hmm. And sometimes you have to create those tools from scratch. Sometimes with the Colorado Community Response Program that you were involved with, you don't. Mm-hmm. That you're just given the referrals. Yeah. So, but like in her program, that was all created from scratch. It's probably still a work in progress a little bit. And I know Michelle has a couple of different screening tools for the housing program.
Adopt an Angel. The
Adopt an Angel program for housing financial assistance for the housing program, and then regular financial assistance for emergency assistance. I mean, it's a lot.
Yeah. So it's not like we just help every single person ever that walks through the door. And I think we also have to be careful about some families come to rely on stuff like our Christmas gift programs and stuff. And some families continue to need it and some are just a little bit entitled. And so that's where it gets to be a fine line.
We have a Families United, which is the name of our department, but they do a Parents as Teachers home visitation program for families with kids 0 to 5. And of course, they've got a whole way that they get people into that program and screening tools. And so it's, you know, those are big parts of it.
Mm-hmm. Yeah. Yeah, there's a lot of cool program areas here. And those ones that you mentioned are all kind of the umbrella of the FIRC, but the FIRC also does a lot of community partnerships, right? And then would you guys be able to talk a little bit about some of the agencies that the FIRC partners with, you know, with immigration, with just in general, the care clinic and some of those other places? I don't know if with some of the people we work with.
Yeah, we could probably talk about FIRC.
Well, the FIRC is a member of the Colorado Immigrant Rights Coalition, the CIRC, which is a statewide member coalition, although they do have a team in Denver that works mostly on legislative issues. So they're very busy right now that the legislature's in session in Denver. They are a traditional, strongly kind of Latino-based immigrant rights group. So the FIRC participates as a member, but it isn't actively an immigrant rights organization. But I can tell you that we have partnered with other organizations on the immigration issue in the last couple of years, some of these events. So that would be the school district, and we're doing this very carefully because everybody's got sensitivities to it. The school district, our local law enforcement, so our police chiefs and our sheriff, who fortunately for us in Summit County are, pretty friendly around this issue. They're law enforcement guys, but they're pretty friendly around it. Of course, our own Department of Human Services and the other department programs who we work closely with. And of course, we're always working with not looking at people's status, but we're dealing with that issue. And of course, as you all know, in the immigration issue, like in our community, we have tons of families with mixed statuses, right? I mean, right now you can have a grandma who is undocumented, a daughter who's a young woman who has the DACA status because she came here as a child, and now she's got kids who are citizens. Or you can have mixed families where some children, were born here and some weren't, and that makes it real complicated in the field of social work to when you're trying to identify the programs that this family qualifies for.
Right. Yeah.
And so that's where we do a lot of partnership with DHS and the other partners, Care Clinic.
Yeah.
I would say, have you noticed, talking about the generation, kind of generational aspect, have you noticed any one particular generation that seems to be more interested in or is accessing services at a higher rate, or is it kind of just all spread out all over the map?
Well, it's kind of spread out. The FIRC focuses on families. So some of our assistance, kind of the core emergency assistance and the parent education programs focuses on families with dependent children. So that's the FIRC's focus, is that family focus. Now we've got other programs like the mental health program, our health insurance enrollment assistance program, for instance, who serve everybody and anybody. But it's kind of based on what the FIRC's focus is, and it's always based on, a socioeconomic situation.
Yeah.
I mean, it's based on money and, and sophistication with the systems.
Right. One thing I'll say that's kind of interesting to that point in relation to mental health and immigrants is that, and I've noticed this dynamic a lot, is that I'll have a teenager who is maybe born and raised here and is fluent in English with some real mental health stuff coming up. And I think that they actually say that young Latina girls are some of the most at risk of suicide, and part of that is really a cultural kind of misunderstanding with their family of origin. And so a lot of what my role has been is in sort of mediating and being a third party to talk about what's going on in the mental health of this kiddo and how the family can be of support, because and there's people that can speak to this way more than I can, but there's a lot of moms saying but I crossed the board, I've been through all of these things and I've had a really hard experience and I've just sort of bucked up and handled it. I didn't need to go to therapy or need to go to the hospital or anything like that, and sort of invalidating the experience of their kiddo and their mental health crisis. And so just a big part of what I do is try to help facilitate that conversation so that both people feel understood and that they really can ultimately access the support that they need and sort of reduce the stigma around that. So we definitely see that a lot, and that's kind of that's certainly generational in its prevalence. One other thing that I don't know if we've brought up at all, but something that's sort of a partnership between Building Hope and the FIRC is our Spanish language program, which works to bring together about like 10 different just community members in the Spanish-speaking community to sort of inform what's going on with their community, and also to spread awareness about mental health and to talk about mental health with their peers and with their family members, and to try to destigmatize that amongst their community members. And as a result, we're seeing a lot more Spanish speakers come and say that they want therapy, and start to say that they realize that therapy is not just for crazy people, and that it's okay to get help and to work through stuff. And there's, significant trauma, especially in the immigrant population, that needs to be helped and dealt with. We don't have the capacity in the county to deal with it, but we are starting more conversations about how to help. And we do have a new program actually coming up called ALMA, and it stands for like Amigas Motivando el Alma. And it'll really be a peer-based support group, support system for Latinas that are experiencing kind of emotional or mental health struggles, to help connect and talk about that, which will be really cool. And we actually are able, I don't know if I'm allowed to say this, but some of the contracted positions that we have through that, folks don't need to have the same status to actually be a FIRC employee, which is another cool way to access the community and offer employment. Did you know that?
Yeah.
We can delete it out.
Don't send this to our board. Yeah.
I can tell you it's, immigration is this topic you guys are dealing with right now. I'm super passionate about it. And I have formed a group outside of the FIRC, which is called Mountain Dreamers, with some young dreamers and some others. And that's to be more active in pushing a pro-immigrant agenda in Summit County in a positive, very, very positive way.
Yeah.
But the FIRC is its own organization, and at heart, it's a family resource center. And the FIRC has really served the immigrant and Latino population here over the years wonderfully well, and that's its mission, to keep doing that. And so that's why there has to sometimes be that separation, or that, you got to think about things. Yeah.
Yeah. It's a sticky subject.
It's a sticky subject.
Tricky
subject. And, it's important to realize that people hold different views on it, and we can hold whatever views we have, and we have to respect that other people have different views, and we can just try to get out there and educate them on it.
Yes, education. And you touched on this a little bit, but I know I've talked to Rachel as well. You guys both kind of have different personal motivations and passions for working within the immigrant population here in Summit. Is there any story surrounding that, or any, I guess, ideas or whatnot?
Like a personal story?
Or just any sort of
motivation?
Like what is the personal motivation for helping out? I know the FIRC is to help all and serve families and whatnot, but just kind of that personal motivation to do a little bit extra for the immigrant community.
Well, part of mine comes from, first of all, it's just something I believe in and always have. Something I've always felt strongly about. But I worked here for 18 years managing a restaurant. Mm-hmm. And I've seen the migration that has happened here, as in the rest of the U.S., over the last 20 years. And I've had the great opportunity, the lucky opportunity, to get to work with and know and become colleagues with and friends with a lot of immigrants. And so it's personal for me now. But it's something I've always cared about. So that's that.
Mm-hmm. Very cool.
Yeah, and I think for me too, I already mentioned this, but growing up here, I was so in a bubble about the diversity of folks that lived here. And then going to school in LA, my best friend in the world became someone who her whole family had immigrated from Nicaragua. And so she kind of helped me understand the personal piece of that. And then in moving to Memphis and teaching there, I taught Spanish, and the reason that I learned Spanish was to like get to know people's stories. And so the more I got to know people and learn stories, at that point I was teaching a lot of kids. So I was in inner city Memphis, a lot of kids that were part of that unaccompanied minors group from Central America were coming. And I was sort of helping to advocate for their families. I was the only Spanish speaking person in this school. That was on staff of school, like 900 people. Anyway.
Where was that?
In Memphis. So I started just like feeling more and more passionate about this, and then moved to Denver for grad school and became part of the social work with Latinos concentration. And through that, just learned a great deal about policy and communities and the dynamics of what it's like to be an immigrant here and how diverse that is. And working in the Colorado I Have a Dream Foundation, worked with several kids that were getting DACA or ineligible for DACA, and just like the most amazing humans I've ever met. And doing all of that right as Trump was getting elected just kind of lit a fire in me, I think, for this community and for how very spectacular they are and how much of a struggle it is to get here and then to be here. So I really wanted that to continue to be part of my work. And though I don't specifically work on the topic of immigration, I think it affects a great majority of my clients. And there's so much mental health and trauma around that and policy stuff. So I'm really happy to work at the FIRC, where I get to keep doing that and work with just awesome colleagues as well, and friends that are from so many different countries and teach us a lot. So
Yeah,
it's cool. It's very full circle.
that's awesome.
Yeah.
I don't want to take up too much more of your time. Do you guys have any final questions, or
Michelle can answer better.
and then
I don't really have a question. I kind of it's more of like an affirmation, I guess. I think it's so rad what you all have been able to accomplish. And I guess it's not really I guess more a rhetorical question of, it seems like it's based largely the support on community support and folks reaching out, hey, we want to help, and those positive partnerships that you've all built. And I guess it'd be nice to see that happen in other communities. It really would. Seems to work pretty well. So yeah, I think it's really cool what you all accomplished.
Where are you all at? Where are you speaking from?
I'm in Denver now, but I just moved here from Grand Junction, Colorado. So I was on the Western Slope, born and raised on the Western Slope.
Mm-hmm.
Cool.
I'm from Granby,
Okay, great.
but originally from Jersey. So yeah.
Pardon?
she's originally from Jersey.
I said originally from Jersey. I'm new, yeah.
And she's working with the mental health navigation program in Grand County.
Nice. Good.
Too.
Yes.
Yeah, every community is a little different. We're different than Granby. We're different than Denver or Aurora, where there's I don't even know how many languages spoken there now.
Oh, it's amazing.
So every community is different, and every community has different types of organizations with slightly different missions. Although at the base, they're all kind of the same.
Mm-hmm.
Yeah.
Sure. But every community's got kind of different challenges too. So
yeah, definitely. Do you ladies have any other questions or comments before we let these hardworking individuals back to their jobs?
I just wanted to say thanks. Thank you for taking your time out today to speak with us, and we really appreciate it. And that's about it.
Yeah.
Thank you guys so much.
Yeah, you bet. Thanks a lot, guys.
Yeah,
Thanks
you.
for going into the ever rewarding field of social work.
Yes.
You're gonna get paid a ton. So
coming from the best. All right. Well,
Awesome.
thank you guys. I really